we're just going to inspect your gums and your teeth. Your teeth are straight, your gums are pink. Just going to look at the roof of your mouth. That's good, it's nice and pink. You stick out your tongue. It's midline, there's no lesions. Good. Your gums adhere to your teeth well, there's no separation. And to really palpate the tongue, I would put on gloves, use a 4x4, and do that in under the buccal mucosa. Your soft palate, you want to lift up your tongue. Soft palate's good, it's pink, it's moist. Take a look at your uvula, stick out your tongue. And your tonsils are good, they're symmetric. Alright, now I'm going to go to your neck. Take off your scarf. Everything looks symmetric. Good. Just palpate your lymph nodes. Do your preauricular, which is right here. Your posterior auricular. Your tonsillar. Your submandibular. And the submental. Good, they're all non-palpable. Now we're going to do the cervical. Good. And the posterior. And your occipital. Good. They're all non-palpable, which is a good thing, so they're not swollen. Now I'm going to do the supraclavicular and the infraclavicular, which is on your clavicle. So I'm going to ask you to move your chin to one side and tuck it in. You can really feel them in there. Good. And now I'm just going to palpate your thyroid. Midline. And you just want to swallow for me. Good, and it moves freely when she swallows. There's no deviation of the trachea. Did you have any tenderness in your thyroid? No? Alright. Now can you move your chin to your chest and back and side to side? Good, and you have full range of motion. Now can you just press against my hand? Good. Good, and you have +5 strength. I'm also going to ask you to push against my foot, and back. Good. And now I'm just going to palpate your temporal artery and the carotid artery. Good. And now I'm just going to auscultate them with my stethoscope just to see if I hear for any bruits. Just hold your breath for one. Good, and I didn't hear anything. So now we're going to go on to the respiratory system. Can you just swing your legs over to the side and I'll just be behind you? So your back is symmetric, your breathing is symmetric, your spine is straight, it's upright. I'm just going to palpate, so if you feel any tenderness, just let me know. Does it feel any tenderness? No? Good. And now I'm just going to go right under here, and you just want to take a deep breath. Take a deep breath. Let it out. Good. And everything moves symmetrically. So now I'm going to test tactile firmness. So I'm just going to put my hands on you like this, and I want you to say 99 every time you feel my hands.
99.
Good.
99. 99. 99. 99. 99.
Good. So as I go down, the vibrations decrease symmetrically, so that is good. And now I'm just going to percuss, so to test for resonance. So if you want to give yourself a big bear hug. Good. So now I want you to take a take a deep breath in and let it out all the way. And I'm just gonna I lost my tape. So right here in the midline is where that is. And then now I want you to take a deep breath in and hold it. Good. So about right there. It's probably about 5 centimeters. So that is good. Now, do you play any sports?
Yes.
So your lungs are fairly good. Now I'm just going to auscultate your lungs. So if you want to take deep breaths through your mouth. You're doing okay?
Yep.
Good. And your lungs are clear. Hear them all throughout. So now I'm just going to see if you feel any tenderness, CVA tenderness where your kidney is. Anything over there?
No.
Any tenderness? No? Good. Alright, so then the next part, I'm just going to talk about, we're not going to actually do it for the breast exam. So the first thing I would, if you do a self one, you would want to just inspect your breasts in the mirror and inspect the nipples for any discharge, any changes. So then you would just raise your arm over your head and just press firmly on both sides. And then the next, you do the same thing with your hands on your hips. Just feel it. Make sure there's no bumps or anything. And then you just inspect the nipple, see if there's discharge. And then and then I would do all the lymph nodes. So you would just go underneath here and just get all the axillary lymph nodes to make sure they're not palpable. Now we're going to do their heart and your pulses, so you can just put your legs back down. So I'm just going to take your brachial pulse. Good. Now I'm just going to inspect, see if there's any jugular vein distension, any pulsations, and there are no visible pulsations and no distension. Now I'm just going to have you lay down. So I don't see, just going to inspect for any visible pulsations, and I don't see any. So now I'm just going to palpate your your apical pulse. And we're going to do your aortic, which is up here. Go down, and the pulmonic is on the other side. Erb's point is right here in the middle. And the tricuspid. And the mitral. And I don't feel any thrills or heaves. And now I'm just going to auscultate. And with this and the aortic, I hear your S2 louder than your S1. Go over to the pulmonic. And again, the S2 is louder than the S1. And now we're going to go down to the Erb's point. And the S1 and the S2, so that's the lub-dub of your heart. They both sound the same. And now we'll do the tricuspid. And the S1, the first sound is louder than the second one. And with your apical, the S1 is also louder than the S2. So now I'm just going to do it with my bell to hear for any murmurs. And I'm going to ask you to lie on your left side. Do the same. And I don't hear anything, so now I want you to sit up and lean forward. Sometimes this can bring out some murmurs that aren't heard in other positions. Good, and I don't hear any murmurs. Alright, next we're going to do the abdomen, so I'll have you lay down again. So, I'm just going to inspect your skin. It's good, it's symmetric. Your umbilicus is intact. Your stomach is flat. No signs of enlarged organs. No masses, and I don't see any visible peristalsis, and no visible pulsations. So now I'm just going to listen, take a listen. Then you have active bowel sounds in all 4 quadrants. Now I'm just going to listen for any bruise. And I would also do that over the iliac and femoral areas. So now I'm just going to do a little bit of percussion over. And it's all timpani. Now we're just going to go for your spleen. And there is some dullness when you hit the spleen. Right up there. Now for your, I'm going to see if I can find the top of your liver. I don't feel it, so when I feel a dullness. That would be about the top. There. So I would measure about 8 centimeters for your liver, just normal, that's good. And now I'm just going to palpate over. Tell me if there's any tenderness.
No.
I'm going to go a little deeper. Do you have any tenderness? Palpate the spleen and the liver. And then I would do your inguinal nodes, which are right in here, and femoral. So now I'm going to have you sit up again. Just going to inspect your legs. So they're good, they're smooth, I don't see any visible venous pattern. They're warm, they're dark olive color. So now I'm just going to feel for your popliteal pulse under here. And then your dorsalis.
Speak up.
And your anterior tibial. Good. I'm sorry, that was your posterior tibial. So now I'm just going to inspect your ankles and your feet. Good. I'm just going to palpate and tell me if you feel any tenderness. Any tenderness? Alright. So now I'm going to have you put your foot forward and back up towards you and move it to the inside and the outside. Good. You have full range of motion. I want you to press up against. Good. And press down. Good. Good strength. So now I'm just going to inspect your knees. Do you have any tenderness?
No.
No? I want you to, actually I'm going to have you lay down again. Alright, I'm going to bend your knee. Good. You want to put it down. You want to bend it and then put it out to the side. Good. I want you to push down on me. Good. So now I want to do the hip as well. So if you want to lift up your leg as far as you can. Good. Then you can put it back down. You're going to move out to the side. Good. You have full range of motion in your hip. So now I'm going to ask you if you can put the heel of your foot and then run it down your other opposite leg. Good, your movement is smooth and that's intact. So now I'm going to do, you can sit up again. I'm going to do your fingers and your wrists. So palpate. Do you feel any tenderness?
No.
Any tenderness in your wrist?
No.
No? Alright. So now I want you to make a fist and put it out and just, yep. Good. You have full range of motion. Now can you just squeeze my fingers? Good. You have good strength. Now with your wrist, I want you to move it up. And you put it down. And move it inside, outside. Now I want you to just push down on my hand. Good. Push up. So now I have two signs for you. So I have the Tinel sign, so it tests for carpal tunnel. So I'm just gonna tap right here and tell me if you have any numbness or tingling after I do it. No? Alright, and the next one I want is a Thales test. So you gotta put your hands like this and keep it there for 60 seconds and tell me if you have any numbness or tingling. Any numbness or tingling? No? Alright, now I'm just going to inspect your nails. They're good, they're intact. Capillary refill, less than 3 seconds. Your nails are good, there's no clubbing. Alright, so now I'm going to do your arm and your elbow. So any tenderness when I palpate your elbow? No? Any tenderness?
No.
Alright, and there's no bogginess. So now I'm going to have you, can you flex it, extend, and then like this, good, full range of motion. And now I'm going to test some coordination, so can you do like this with your fingers as fast as you can? Good. And now with your hands, go like this as fast as you can. Good. And now I'm going to hold my finger up. Can you take your finger and put it to your nose? Into my finger? No.
What?
Do your finger go like this to my finger. Keep going. Good. Good coordination. So now I'm going to test your reflexes. So first I'm going to do your biceps. So if you want to flex for me, so I can feel your tendon. Go ahead. So just relax. Then I'm going to do it in the back. And now I'm going to do your brachioradialis. Okay. And now we're going to do your knee. So if you want to go like this for me. Good. And now I'm going to do your ankle. Good. And now I'm going to do what's called the Babinski. So I'm just going to run this under your foot. And good. You want your foot to go like this. If it went the other way, that wouldn't be good.